Hi guys, we are producing this new instructional video in preparation for your coming Neuro-OSCE examination. Very important, this is still work in progress. But we are prematurely releasing it so that it might help you in preparation for the exam. At this point, I would like to thank all our patients who have agreed to have their videos taken to help you learn more and easily on neurology. So, I hope you learn a lot from this video.
This is the best I can do.
Since that time that we have started the Neuro-OSCE, we have been criticized that our students are very good in doing the neurological technique. However, they said that they may be doing it very well, but they look like robot, not knowing what they are seeing, unable to interpret the findings that they see. So, in this case, I would like to tell them that we are moving one step forward. We're telling them we are not robots.
Together.
I don't blame you as you are still first year with many exciting years ahead to know about the various neurological diseases with their signs and symptoms. So, I am titling this video, We Are Not Robots. Neuro-OSCE is not just for standardized neuro exam. Take time to view this and hope you do well in your examination. Whenever we see patients consulting for neurological complaints, we ask ourselves three things. Number one, is there a lesion? If there is a lesion, we ask question number two, where is the lesion? Is it in the brain, brainstem, spinal cord, muscle, nerve? Is it on the left or right side of the brain? Is it cortical, subcortical? Okay, and later on asks number three, what is the lesion? For the medical students, the first two questions can be addressed early as the first year level, while the answer to the third question would come with study of the diseases during their second years and onwards. But for the clinicians and more senior students of the neurosciences, I would like to add a fourth question, namely, can anything be done about the lesion? Although it is true that there are lots of advances in the neurosciences, including neuroimaging and modalities like MRI and PET scan, among others, nothing can replace the human brain in localization. As a response to requests by our students, we are adding this new section in our video series, okay, for the basics of localization in neurology. Now, why is it important that we do localization? Why bother? Well, there are many reasons. Among others are, it will offer us a differential diagnosis if we know where the problem is. It can give us an indication of a potential cause. Knowing where the lesion is allows better selection of imaging and other diagnostic tests. And it can also be used for directing for appropriate treatments. And knowing what the problem is now and where it is it widespread or just focal, it gives us an indication of prognosis. Lesions may go undetected on standard imaging studies unless the studies are specifically focused on the anatomical region hypothesized to be involved. Similarly, neuroimaging or laboratory studies may disclose incidental abnormalities that have no bearing on the patient's symptoms and the further pursuit of which can lead to unnecessary time, expenses, and can even potentially harm the patient. For one to be able to localize where is the lesion, we have to arm ourselves with some basic tools. Okay, a knowledge of neuroanatomy and the different pathways is essential. Now you'll appreciate the many hours you have given to know the different neuroanatomical structures and learning their functions. Complement this with what we have learned with neurophysiology, knowledge of blood supply of the brain and spinal cord, and later on, knowing the different disease process that affects the nervous system. Okay, we will be able to equip ourselves and be able to zero in where the problem is. There are two methods of localization. One is topographical localization, and the second is type localization. Let's first discuss on the number one, topographical localization, meaning attempt to identify what specific area in the nervous system or neuroanatomy is involved that would explain the patient's neurological complaint as well as the findings in our neurological examination. Okay? The problem can be either in the cerebrum, either below the cerebrum, that's the brainstem, and let's put together the cerebellum. It's either in the spinal cord, and as the nerves as it exits, the spinal root and the peripheral nerves, both motor and sensory nerves. It can be in the neuromuscular junction or even in the muscle. Okay? So there you have it. It can be anywhere in this area. So therefore, we have to approach it slowly and scientifically. Guys, proceed to part 2. The plot thickens.